All right. Well, good afternoon to everyone. Thank you so much for joining us today for our webinar titled Community Engagement Strategies for Diverse Immigrant Populations, Building Trust and Improving Outreach Through Language Access. My name is Dan. I will be your host today, and presenting today this presentation will be Sabrina Morales, the CEO of Linguistic International. So just to begin, I'd like to point out the following. Well, some housekeeping items before we start. Thanks to those that attended our last webinar, Interpreter Communication Protocol and Guidelines. In that last webinar, we focused on best practices for preparing for both interpreting appointments and live sessions. We also talked about communicating effectively with interpreters and maintaining professionalism, neutrality, and compliance. So thank you so much to those that attended this last webinar. It's another housekeeping item. It's important to notice that we previously held these webinars on the fourth Tuesday of every month, but starting this next New Year, which is coming up really quickly, I can't believe that it's already going to be Christmas and New Year's. But starting next year, we're actually going to be holding them every fourth Wednesday of the month so that all of you here in attendance could keep that in mind, please. We'd love to be able to keep seeing you here in our webinars as your participation and your engagement and your being here present is very meaningful to us. So again, that's going to be held every fourth Wednesday of the month. This following webinar is going to be developing and implementing a language access plan. So maybe some of you might be thinking, oh, what is a language plan? Why would that might be useful for me? So basically, a language plan, what it does, it helps you, it's a formal document that outlines how an organization ensures individuals with limited English proficiency can access services, information, and programs while maintaining and being compliant with Title 6. And so this is going to help your organization know how you can develop, implement, and sustain a language access plan. So we're very excited to share that with you. We feel that that will be very beneficial to all of our clients here in attendance. So please be on the lookout for that. That's going to be held on Wednesday, January 28th of next year. As a reminder, we're going to be having a Q&A session at the end. So if you have any questions while Sabrina presents, please keep notes of that so that we can talk about that at the end. And I do want to mention that we do have a list prepared for future webinars. All of our webinars are based on the discussions that me and our team have here at Linguistic International. Part of the discussions or topics that we show and talk about with you are based on previous feedback that other clients have given. And this is related to topics concerning language access, equity, and Title VI compliance. So that being said, if at any time, you or a team member of your organization feels very strongly about a topic, feels passionate about something related to language access, something related to compliance or Title VI, or something even like such as what we're viewing here in the future, anything related to like a language access plan, anything like that, do feel free to let us know. Feel free to give us some feedback, send us an email. We'll be providing some contact information in the end for you to have because we're very interested in knowing what some topics, what are these topics that you're passionate about. So do let us know because we keep this in mind, even though we already have a schedule in place for all of our webinars, but just, at some point in the near future. So we'd appreciate that. And last but not least, I'd like to be able to also present or give a little bit of intro here to our presenter today, Sabrina. So she is the CEO of Linguistic International, and she's not only a certified interpreter, but also a national trainer and a trusted leader when it comes to equitable language access. For more than 23 years, she's worked alongside local, state, and federal agencies, helping to create interpreter programs that are both compliant and built to last. Sabrina earned her MPA from the University of Utah and has also completed executive programs at both Stanford University and Babson College. And before handing the time to Sabrina, just very quickly, again, what we'll be talking today about is effective community engagement for diverse immigrant populations and how that all, works for building trust, improving participation, and ensuring equitable service. So that's what we'll be talking about today. And I'd like to now give the time to Sabrina so she can give us this presentation. Thank you so much, everyone in attendance.
Thank you so much, Dan, for the introduction, and thank you, everyone. I know that as the year wraps up, your calendars are probably super busy, so I truly appreciate your time, and I'm going to make it worthwhile for you. I'm going to try to speed it up. I know that we don't necessarily want to watch a PowerPoint presentation for an hour. This topic is very, very close to my heart. Community engagement strategies. I used to deal with that a lot when it came to working with diverse communities. I used to be the executive director of a nonprofit organization that worked with immigrant and refugee communities. And I remember, back in the day, I used to manage grants together with the health department. And so we would outreach different projects in the community, HIV prevention, breast cancer awareness, you name it, special vaccine programs. And many times the big question for government agencies is how do we get everyone to participate in these programs that we are implementing, right? How do we get community engagement by the masses? How do we involve everyone in the community? How do we get the representation from everyone, from all of our constituents, whether they are immigrant and refugees or not? And so today we're going to talk a little bit about that. I want to make this very hands-on. Just quickly, a little bit about Linguistica. So we cover 355 different languages. As Dan mentioned, we've been around for almost 24 years now. We specialize in the government sector, so we provide services only to state agencies, cities, municipalities, and county offices. And we've done some federal work as well, but our focus, our specialty is in the public sector. We offer these four services listed here: on-site interpreting, video remote interpreting, over-the-phone interpreting, and document translation. And something that most of our clients are unaware of, and I think that they don't take advantage of as much, is the training aspect of this. So we can come into your offices and train staff on how to work with interpreters. We can help you implement the class standards, which is the document developed by the Department of Health and Human Services around language access, how to create an environment that is welcoming for everyone in your community. So that goes hand in hand with what we're going to be talking about today. We've done many trainings before and consulted with many different agencies. And one thing that we've been able to see over the years, over and over again, are amazing best practices. Strategies that different agencies use across the 37 states that we work with that really make an impact on how they serve their different communities. So I want to start off by just mentioning why language access is a strategic issue. I guess the big topic here is it's a big issue because if you don't provide language access, you will not be able to communicate with a big portion of your population. Knowing your numbers is really critical. Knowing the fact that, language is a civil right. There's laws that protect language access for limited English proficient people. We won't get into that too much today because we have a bunch of webinars on the legal aspects of language. But I do want to mention that when it comes to language access being a strategic issue, for this particular topic, language access is an issue because it's a matter of trust. If organizations outreach, even with the best budgets and the best policies and the most comprehensive marketing plans, but they only do it in English, they are essentially limiting themselves, right? They're only catering to this particular group. And it's going to be very difficult to build the trust with the different communities and the credibility necessary for them to come to your organizations and to participate in programs overall. Again, the legal and the financial risk exposure, we have talked about that in previous webinars. This is the last bullet point here. I won't mention too much of that right now just because there's webinars focusing on that specifically. I do want to tell you that last night I had to revamp this particular slide because I used to say that there are over 67 million people speaking a language other than English at home. And according to the Migration Policy Institute, that number has increased to now 70 million people in the US speaking a language other than English at home. That's approximately 26 to, they say, between 26 and 30 million of these individuals are limited English proficient. That doesn't mean that they don't speak English. That means that they speak English um, well enough to have sometimes a short conversation, but not well enough uh, uh, to handle specific instructions or eligibility forms, consent forms, things like that. And really, the limited English proficient world or group, there's a huge range, right? From people that barely know how to say I don't speak English to people that can communicate well enough but need an interpreter anyways when it comes to court proceedings or medical issues or again eligibility issues, right? LEP populations exist in all 50 states. This was a very interesting, this is an article from the Migration Policy Institute. The data, unfortunately, for this particular data set is, it goes up to 2023. They're working on their latest data now, but as you can see, the percentage change there for the states where we're seeing the largest increase of LEP community members are in states where we're not really expecting that increase, right? North Dakota, South Dakota, Delaware, Tennessee, South Carolina. What the difference is between absolute growth and percentage change is absolute growth means the number of people that have entered that state. So the number of people in the room. The percentage change is equivalent to how how uh, how full the room is. So in this case, people in North Dakota are going to experience a larger change than the individuals in Florida because in Florida they already have systems in place meeting the needs of LEPs. North Dakota, however, is seeing an 87% change. And what's interesting about this, and my staff are probably aware of this right now as they're seeing this for the first time, is that these are some of the states that have reached out to Linguistica for more services over the last year. So it's very interesting to me, those changes are happening and these government agencies are becoming aware that those needs are there. So let's talk about who's considered an LEP. And like I mentioned, LEP, there's a huge range, right? From people that don't speak any English at all to people that speak enough, but that will struggle with complex situations. LEP interactions with public systems, they exist everywhere. And I'm sure you've seen it already in schools, in healthcare clinics, social service agencies, courts. When people are coming in to these different organizations, they are hoping that they'll be able to communicate. And I've seen it firsthand many times. Government agencies, they try to do their best when it comes to welcoming everyone from every community. But I think the thing that makes the biggest impact is having a language identification poster, because when people see their own language there, they can point to it. Also, the other thing that makes a difference is at the front desk area, having availability of either video remote interpreting or over the phone interpreting. So you want to make sure that your front desk areas are equipped with information on how to access interpreting services. I also want to say that I think the biggest difference that government agencies can make is hire people that look like the communities that they're serving. Many times, as a language service provider, we're coming in to provide interpreting services when they're needed for all of those rare languages and for the more common languages as well. But you want to make sure that your staff members are also representative of the community that you serve. So language access is a civil right. Title VI of the 1964 Civil Rights Act prohibits discrimination based on national origin. Language access is recognized as a national origin issue. So this means that any state agency is required to provide interpreting services. Now, things at the federal level changed a little bit in March of this year when our current administration passed the English only executive order, which pretty much defunded all of the language access programs for the federal government. But one thing to understand, and the discussion that's happening right now within the language industry is even if we don't have money for food, we still have to eat. So the reality is people are coming into our organizations that don't speak English. How do we meet those needs? And it's a complicated question. For us, being in the trenches, we want to give you examples of some of the best case scenarios that have happened, right? Best practices that we're seeing nationwide, and hoping that you can implement some of those things effectively. I'll talk about 5 strategies as we move along this presentation. And I will not bore you with small details because I think that really the meat of the conversation really is what can we do and what can you implement effectively right now? What laws? So the laws that require interpreting services, they're basically saying you have to provide as a state agency timely language assistance, qualified interpreters, translated vital documents, and all of this at no cost to LEP individuals. So we know that compliance alone is not enough. Compliance only ensures that you're meeting the legal requirements, that you are ready for an audit, and that you are essentially, in practical terms, keeping track or monitoring the use of interpreting services. However, we know that it's not enough because having the service available and actually providing the service to everyone in the community and making sure that they're coming to your offices are 2 very different things. Some of the common language access gaps. So what do we see? What we're seeing is when you don't have your outreach materials in the languages of your community, you will limit access to individuals that speak different languages. When you have inconsistent interpreter availability, that will also limit it. So I've seen, programs outreach and provide interpreting services for a good time. And it's almost like if you build it, they will come. And during the time that they provide interpreting services, people are flooding their offices. But then as soon as they stop, that service is no longer available, obviously, to that sector of the community. That's why I personally am very passionate about saying, make sure you know your numbers. Who are you serving? And are you able to hire people from those communities as well? To make language services more cost effective so that you're not only using interpreting services, but that you're also having staff members that speak that language. Now, if they're providing the service in that language, that's perfectly fine. If you're asking staff members to interpret, please know that they need to be trained. Just because someone in your office speaks another language does not mean that they can interpret. I have seen this over and over again. I'm a trained certified interpreter for many years, and what I've seen is staff members would come in, they had been interpreting for years in their organizations, and they really did not know how to interpret. They did not know how to clarify. They were summarizing messages. So it's really important that they receive training on how to actually provide that service if they are doing so. Oh, sorry, one last thing that I forgot to mention here. And this is a big topic in this particular training is being reactive rather than proactive. That is one of the most common gaps. So what do I mean by that? If you need language services, it's always better to plan ahead of time. The first thing you do is, who am I serving? Who's in my community? And don't assume the old numbers are the same, because after the pandemic, people started moving to from large cities to very rural locations, that speak different languages. So it's not just New York City now that has the highest diverse language community. It's places that are very rural. It's counties and cities and municipalities that have never seen interpreting services be needed before, and now it's something that they're requiring. So being proactive means having an account set up already with your language service provider, whether that's Linguistica or whether that's another company, making sure that you have the steps in place. If your staff members need to use interpreters and they don't know who to call or how to do it, it's going to be very difficult. And at the very last moment, when they're scrambling, they won't be able to provide the service effectively. I was just having a staff meeting right now, or a meeting with one of my staff members with a Department of Health and Human Services in one of the states that we offer services to. And we were talking about their suicide prevention hotline. And suicide prevention hotlines, obviously, a hotline requires services immediately. And when those services are not available immediately, the consequences can be dire, right? And you don't want a staff member in that kind of office or that kind of setting scrambling to figure out how to use interpreters when somebody's calling in speaking a different language. Same thing with big outreach projects, and we can talk a little bit more about that in the strategy slide that we're going to go through next. So there's 5 strategies that I'm going to share with you. Language first outreach is focusing on this. First, you want to, and again, I know that I've said this a few times in this presentation, but this is critical. You have to identify the top languages that are being served in your community. So let's say that you're going to do an outreach project around vaccines or around emergency preparedness in your community. You want to first identify who is out there in my community and what languages do they speak. So you can get this from data within the government agency that you work with. You can get it from us. You can get it from the census. You can get it from the U.S. Family Survey data. That's, I would say, the most recent data. And the Migration Policy Institute is also a great place to go. But you have to narrow down your area and who you're serving. Then you want to make sure that you're translating all your vital materials, because if you're only sending your materials out in English, then you're essentially, only catering to that group, right? And don't be surprised if there's going to be low turnout or there are only English speakers in the room, even though you're in a heavily Asian community. No one's going to come to your events if those materials aren't going out in various different languages. Also, kind of think about the language that you need to use, right? We already know this. I know the health departments, government agencies are amazing at this. You guys understand that accessible language needs to be what goes out in marketing materials. You can't make, your materials too fancy, too complicated, using high register, high terminology. It's just not possible. You want to make sure that you're catering to everyone in the community and using accessible language. You want to adapt your content culturally, not just linguistically. I remember I was at a local health department clinic once, and I was looking at their materials, and one of their materials was referring to um, uh, people's movement. And one of the questions was whether or not they felt pain when they did movements like golf. And that just seemed to me so inappropriate. It was a clinic that was in a very low income area. It doesn't make sense to give examples like that in our materials. And I know that all of you know this, so I don't want to linger in that particular idea, but just make sure that you're evaluating your content. Are you serving primarily Mexican community members or Venezuelan community members? Or, what region of the world are you catering to in your materials, so that way it makes sense, not just linguistically, but also culturally. Also, make sure that your website and not only your flyers, but that your website also is culturally relevant, right? And that you translate notices, and that for hotlines, that you make sure that the messages are also done in whatever language you need, so that the recordings are there in multiple languages. Strategy number two are interpreting at key touch points. So think about what are the areas where your limited English proficient people are coming in through, right? Where are your LEPs? Intake and enrollment, that's like number one, right? You want to make sure that you are providing services to your staff, you're providing materials to your staff, or that you yourself have materials that you can use during intake that makes sense for people that are coming in. That your appointments and meetings, that you have interpreters available there, or that you have the meeting, you know, actually provided in whatever language, you know, your community members speak. In crisis or high risk situations, I gave the example of the suicide prevention line. Those are places where you definitely need to have interpreters available. And I would say even in speed dial. Why? Because you want to make sure that you have all languages. One thing that we've seen is when government agencies hire the communities that they serve, you know, they're conscientious of that. They need to also be aware that, you know, you can't hire 355 different languages for, you know, one reception area, right? So interpreting services are vital because they will cover those languages that you don't have available. And if you just have one Spanish speaking nurse, know that that one Spanish speaking nurse is not going to be enough to meet probably the needs of the entire clinic. That's one example, right? You want to make sure that your your touch points, your key touch points, or the places where people are coming in, um, are well equipped to be able to handle any language. That those decision making moments are moments where you've already thought about the solution ahead of time. Oftentimes, what I've seen in terms of best practices again is, you know, that there was a client that we had many years ago. What they did is they came in as secret shoppers, and they went through the process like a secret shopper, and they created all kinds of challenging scenarios for their staff members. And based on those results, they decided to modify their processes to be able to meet everyone's needs. Strategy number three, staff training and confidence. What do I mean by confidence? This is know that your staff will get nervous when they have somebody coming in that doesn't speak English. I think it's, you know, the first thing is most of us are just like, how do I help? Like, what language do you need? Most of the time, we don't even know what language individuals speak. And so we don't even know what language to request if we have an interpreting service. So, a few things. We can help you with language identification. Make sure that your staff know how to request interpreters. Make sure that you already have an account set up with your language service provider. So if we are already your vendor, make sure that our number is listed in your areas and your key touch point areas, right? And you know, I don't know if your other language providers can do this, but I know that we do this all the time, is we can train your staff on how to work with interpreters. The key thing that I say there is don't speak to the interpreter, speak to the client or customer, whatever you decide to call your LEP. Make sure that when you are speaking through an interpreter, you're still looking and communicating with that individual, and speak in first person. So, Maria, how are you doing today? I want to make sure that you took the medication, or were you able to fill out the Medicaid eligibility form? Did you send in your, you know, your the worker compensation form that I asked you to? Whatever the question is, I am speaking to Maria directly, and I'm not speaking to the interpreter. The interpreter knows their job, and they're going to be doing the same thing. But oftentimes, what happens when we train staff is they become more confident with the service. Recently, there's been a move towards video remote interpreting, right? That's when the interpreter is on video. A few problems with that is technical problems where your staff don't necessarily know how to turn on the camera, or what computer, what room they use to have an interpreter, or are they using an iPad, or are they using their iPhone? So think of those things ahead of time so that you're ready and that you're prepared and that they know what to do when they're requesting the interpreter. Community-centered engagement is strategy number 4. You want to make sure that you are partnering with organizations in your community that are going to help you outreach to the people in your area. Let me give you a concrete example. Let's say that you are a Department of Health wanting to do outreach to people on breast cancer awareness, okay? And you notice that there is a growing refugee community in your area. Well, I can tell you this from working with with nonprofits for years and living and breathing in the language access world. The first thing you want to do is you want to reach out to popular opinion leaders or nonprofit organizations that are working with those refugees. So you want to have a relationship with the local nonprofits that work with immigrants and refugees, the language companies. You want to make sure that it's not just, you know, in order for you to reach those communities, it's oftentimes better to reach them through the community organizations that they're already going to. This can be churches, it can be, community organizations, either funded or not funded by government. They can be private nonprofits, but they will be essential in outreaching. So in this case, you would, you know, think language first, right? Think about what numbers, what community members live in my area, what languages do they speak? Okay, based on what languages they speak, I'm going to translate my outreach material in those particular languages, taking into consideration culture, right? Because sometimes language is not, you know, universal in the sense of, Spanish, for example, if you're translating something into Spanish, but the individuals from Venezuela, you might need to use certain terms versus if you're outreaching to a Mexican community, right? And then you're going to say, okay, now I'm going to distribute my outreach material to the nonprofits that are working with those communities and make sure that they are inviting those individuals to participate in, in this event or in this, to become aware of what's going on in their communities. You want to essentially meet community members where they are, and you want to offer multilingual information sessions. So let's say in this case, breast cancer awareness, you're going to do an event. You want to make sure that you have interpreters there because now you've already invited them, right? So you want to make sure that if you invited them through a Spanish brochure, you want to make sure that there's also interpreters available, or that you have staff members that speak that language that can give the informational session in that language. Anytime you're outreaching to immigrant and refugee communities, you probably want to make sure that you have childcare available, that you make the session short, and that you make it after work. I just participated in the National League of Cities conference a couple of weeks ago that was held here in Salt Lake City. And one of the big topics that they discussed was why are immigrants and refugees and, LEPs not participating in our city council meetings? And there was a full topic on this, a full discussion on this topic. And a lot of times it has to do with, city council meetings being scheduled in places that are too difficult to get to, no childcare, during work hours, where people are not available to come, no interpreters are available, the marketing was done only in English. So it's no surprise that individuals wouldn't show up in those situations. But it does take a little bit of forward thinking and proactiveness based on, who you want to invite and what you want the outcome to be. So, and then you want to incorporate community feedback. And this is really critical because a lot of times surveys are done only in English, but when you do a survey in another language, you really do get a full sense of, wow, maybe my non-English or my LEP community members got a completely different uh, uh, reaction, or you get a completely different reaction from them than you do your English speakers, and that's valuable information, right? Was the message communicated effectively, and what would change? And a lot of times, our communities, our immigrant refugee communities, they can give us feedback about how we should modify our programs to be more successful and to be more effective. Lastly, measure and improve, and this has a lot to do with evaluations as well. You want to track interpreter utilization. You want to track participation rates, client feedback, and compliance indicators. So, you want to think about that ahead of time. If you're going to give a survey out, you want to translate it ahead of time and make sure that people are filling out something that they understand. So we know that language access reduces risks in so many ways. There's fewer complaints and grievances, stronger audit readiness, protection of federal funding, which this third bullet point really is almost irrelevant at this point, based on the situation that we're in with this particular administration. There is no federal funding available for language services anymore. But again, we have to eat, right? The state continues having to provide the service, and so do federal agencies. So even though the federal funding is not there, we have to figure out how to best provide these services. And thinking about it ahead of time too, you can think, what can I do internally to reduce my cost, but also make sure that I'm still being as inclusive as possible. Um, Also, just a quick note there. Family members or friends are not people that should be interpreting at any moment. The number of risks are gigantic. There's states that have laws that regulate this particular issue. Like, for example, in California, no one under the age of 18 can interpret because it was such a huge problem. Parents had their kids interpreting in medical appointments at schools, and there were many, many problems happening, as you can imagine. So it's really important that when you think about, funding, that you don't just eliminate the service altogether, because when you eliminate it, you are excluding a big part of your community, but you're also creating legal risk for yourself. And then when family members or friends are put in the situation of interpretation, they can create so many legal problems, but also it's quite traumatizing for a child to be interpreting in a medical appointment. I've given this example before, but just to mention it here, I interpreted for a situation where a father had been going to an oncology clinic for cancer treatment, and he didn't know that he had cancer because his son had never told him that he had cancer and had been interpreting for him for several months. And the clinic imagined that was the case, but they didn't know. And so they called an interpreter to come in and figure out what was happening. It's an extreme situation. I was quite shocked that that could even happen, but things like that do happen. And unfortunately, worse things than that, that's just an example of something that can occur when a family member or friend interprets. Um, I'm going to focus on the key takeaways. So when it comes to language access, the key takeaways here are: language access is a civil right. We know that through Title VI. We know that through the Affordable Care Act. ACA also has a rule around interpreting services. But more than that, it's a trust issue and a public safety issue. So you want to make sure that if you have the intention of engaging with your community, that you know who they are and that you create trust with them by providing services that are comprehensive and that are well thought out, so that you're not just, eliminating or uh, excluding a big part of your community. You want to be proactive in planning. Use us, contact us. We're here to help you in any way we can. If you have a project that you want to engage community members on, We can give you more examples. We can put you in touch even with other government agencies that have implemented best practices. So that's another tool that you have with us. And really, small improvements create big, big impacts. And what I mean by that is just very basic things. If you have a front desk staff member that is receiving individuals from the community, and some of them might be LEP, make sure that they have an access card where they know who to call for interpreting services and what their account number is, because most language companies start off by asking that, right? You want to make sure that the front desk area has clear signage that you provide interpreting services. Cities are having a big, big focus on this right now because they're noticing that more community members from immigrant and refugee populations are shifting and moving to smaller rural locations. And so it's really interesting to me, and it's exciting to see that that's happening. This is my contact information, and Jordan James and Dan Tenorio's contact information. They help in the account management department. They're amazing people. Dan was our host today. Thank you so much, Dan. If you have any questions, I would love to answer them if I can, and if not, I will research and try to figure out how to give you the answer.
This is Dan.
Okay.
While we wait for questions, I did want to point out something really quick. Anyone that has questions, feel free to unmute yourselves or add a question in the chat box. So again, thank you so much, Sabrina, for that great presentation. That was very insightful when it comes to the diverse communities, when it comes to language access as well. I just shared in the chat box a survey for today's presentation. It's from SurveyMonkey. It's really short, it's really simple. It's just 6 questions. It's just basically asking what you guys thought of the presentation today. What feedback would you have for us? As mentioned at the beginning, at the intro, if there was a topic related to language access you'd be more interested in learning about for us to keep in mind for future webinars, please let us know. And so we've added that link to the chat. If you'd like for us to, email that to you as well, we can. So feel free to share your emails with us at the end, either in the chat box now, or you can email us based on the information that you see on screen. Also, Sabrina, I've sent it to you. I don't know if you'd like to just show how the survey would look like. I just sent it to your email in case you'd want to share that. You don't need to, but just so that you guys could get a feel for what that looks like.
So essentially I just clicked on the chat survey link, and it took me here. Yeah, any feedback that you have for us. This presentation was recorded because we upload it to our webinar section on our website, and we share with clients that weren't able to participate today. But I appreciate your time, and I hope you have great happy holidays, great time with your family, and hope to see you next year in the other webinars that we have coming up. Thank you so much, everyone.
Thank you.